What we are providing today is the second in a series of 4 trainings by Diane Zucker. She is going to provide training on CPT coding in relation to behavioral health services. The training is not specific to any payer source at this point in time. We're just getting a lot out into the system and doing a lot of level setting across. There's a lot of knowledge out there, and there's a lot of, some not so much knowledge. CPT coding is new in the system to some areas, especially if you've not had a lot of interaction with private insurance. So with that, we have a couple slides we'll do from the BH Redesign side. We call it the 10,000-foot level. Probably could call it about the million-foot level overview at this point. So with that, I'll hand it off. Mary, if you want to pick up with this, and we'll go from there.
Very good. Thank you, Doug. Good afternoon, everybody, and welcome. We appreciate you taking time out of your day to come to this training. My name is Mary Haller, and I'm with the Ohio Department of Medicaid. And we're going to do a little bit of an overview here of what behavioral health redesign is. As Doug said, this is the first in what we hope to be some ongoing training with the provider and the stakeholder community over the next year and a half. So we know that we all have a long road, and we're there with you. We're going to be traveling right with you. So appreciate you coming today. Behavioral Health Redesign is a collaborative project that is jointly owned and operated by our 2 departments, the Department of Medicaid and the Department of Mental Health and Addiction Services, with guidance from Governor Kasich's Office of Health Transformation. This is far from a simple or quick undertaking. There's a lot of potential for it to be hugely confusing, and so we are working with all of you as stakeholders and especially as providers of services to Medicaid enrollees to try and make sure that we have a common set of understanding about what BH Redesign is going to involve. We've been trying to use a very open and transparent process where we have had numerous meetings with stakeholders. We will continue doing that. In addition to those meetings, we are also working very hard to communicate with the field. We have newsletters. We've reinstituted the MITS bits that we started a while back when we did direct billing to Medicaid. And so those are coming out regularly now with little pieces of information about BH Redesign. We also have a website that we have up, and we'll show you a picture of that in just a minute. So we're really working hard at communicating with the field. The principles of the BH Redesign are essentially to expand services that are available to Medicaid enrollees who need the help of community behavioral health agencies, and with a particular emphasis on integrating physical and behavioral health care. We're also working to move to more evidence-based practices, and in particular, the 2 that you'll probably be most familiar with are assertive community treatment and intensive home-based therapy. As you know, those have not been overtly paid for by Ohio Medicaid, and we are going to be doing that in the BH Redesign. So you won't have to bill for units of counseling and CPST. You can bill for the whole thing. We're also working to implement and pay according to the American Society of Addiction Medicine levels of care. So for those of you in the addiction treatment field, that should be a very interesting change, and one that I hope will result in some improved health outcomes. We're trying to move towards value-based payment options and rewarding positive health outcomes, and as we're focusing today in this training on coding, we are trying to align with national standards of coding. So those of you who have commercial business, Medicare business, you know about the National Correct Coding Initiative. We're also going to be working to assure that practitioners are practicing at the top of their scope, and that we're modernizing our codes that are billable to Ohio Medicaid. We're still in the process of making a lot of changes. And so we don't have finished products for you today with regard to Ohio Administrative Code or provider manuals, but we are working on those and we will make them available to you as soon as we have them finished. Those two sources will be the Bible, if you will, of Medicaid behavioral health. That will be your guidance for what the policy is going to be for Medicaid behavioral health. And as I said, those are going to be communicated as soon as we get them done. And then we're also working to update our Medicaid information technology system so that it is reflective of the changes in policy. Just to talk a little bit about the timeline for change. We have recently moved the timeline back 6 months. We were originally going to be trying to get started with implementing a new code set beginning this coming July 1. We have moved that back to January 1 of 2017. So on that date, what is going to change is as follows. Claims will begin being edited for third-party liability. So if your consumer has any other kind of health care coverage, that coverage is going to need to be the primary payer, and Medicaid will be the payer of last resort. Behavioral health Medicaid claims must be submitted with a rendering practitioner on the claim, and we have a couple of MITS out that give some pretty specific guidance on who those practitioners are. Essentially, they're licensed practitioners, and they will need to enroll with Ohio Medicaid as practitioners. And then their identity, their NPI, will need to be listed on the claims. Also on January 1, we're going to be discontinuing mental health pharmacologic management and SUD med somatic codes. We are replacing them with the evaluation and management codes that we're going to be talking about today, along with a number of add-on codes that can accompany those for a variety of different conditions. And then also in addition to those codes will be laboratory testing and vaccination codes that are also going to be made available. We're really trying to round out the primary care services that are available to community behavioral health centers who have medical practitioners on staff. I think we were asking for questions to wait until the end. The timeline, just continuing with the timeline on the service coding, providers will have the opportunity beginning July 1 of 2017 to voluntarily, beginning January 1 of 2017 to transition to the new code set, the full new code set. So there's going to be 6 months between January of 2017 and July of 2017 where your agencies can transition voluntarily. Someone asked yesterday what the benefit of that is. The benefit of that is that you'll get access to the full code set. And when I say the full code set, I would refer you to the BH Redesign website. You can see our massive spreadsheet that includes the lists of codes down the side and the lists of all the practitioners across the top. We're moving away from just having 18 things you can bill to Medicaid. So you're going to have probably 60 or 70 things you can bill to Medicaid that are legitimate CPT or HCPC codes. So then mandatory transition will occur July 1. So if your agencies haven't transitioned before July 1, that will occur as a requirement beginning at that time. So Ms. Zucker's training today is the first in a series, and she's going to focus today just on CPT codes, not on the HCPC codes. That's probably very relevant to you because a lot of what you bill currently are HCPC codes, and the CPT codes may not be as familiar, but they are there. We just aren't talking about them today. So your dependently licensed practitioners, your paraprofessionals who need to bill their services using HCPC codes, we're not forgetting about them. We're just not talking about them today. This is the bh.medicaid.ohio.gov website, which I would point you to. We're trying to post everything up there that is relevant to the BH redesign, including the presentations that you're seeing today. So with that, I will turn the turn the podium over to Diane Zucker.